Iṣẹ́ ni ogun iṣẹ́, as my people will say. So that means that your work is the medicine for poverty or against poverty. So just showing you a day in my life. This is the trouble it takes me to get to work. So much traffic because my work is situated in a hospital and it just keeps going slowly. Takes me about 40 minutes instead of 10 minutes and I have to leave really early. Sorry. So stressful. Anyway, just prepping myself to go into work now, putting on my badge. You see that annoying red fluff? It stayed with me all day. And my colleague offered to take my photo, which is really nice. So I could kind of show you how my office looks like. This is my locker and all the naughty things that I have in my locker. This is my regular breakfast of yogurt, honey, blueberry. So the time now is 10:18. Was meant to have my first appointment at 10 o'clock, but there is a situation here. I've been blocked in, yeah, at the car park, so I can't really leave. So my first visit is going to be a trusted assessment. You usually get like 4 hours to do that. That's the visit plus the paperwork. And then I've got medical duties, and what I've got to do is to drop off medication for another patient. So I've got 2 calls, and then I'll be back in the office on the desk. But between the 2 calls, I've got about 5 hours to do the calls and the paperwork, which is actually a lot, but that'll be just for another day. So I'm still waiting for this person to let me off because it's a terrible situation here at the car park. It's really bad. Okay, so talk to you later. Bye. So I've just finished my first assessment. Time now is 11:28. I should have finished this since 11, but I didn't get out of the office until I think to 11, and it's just been a bit of a lengthy assessment, but it's done now. So I'm going to the next one. I can't really show you the area because nothing to identify the client. So it's a trusted assessment where we decide whether someone needs to be taken on to the home treatment team for crisis management or risk management or medical review or treatment or support. But we decided, because it was a visit with my colleague and nurse, we've decided that this person doesn't need the home treatment team at this point, and we've given them the support and encouraged them to use the support that we've signposted them to, and just asked them to use their GP for medication, prescription and management. All right guys, I'll go to my next one, which would be a drop off of medication. Okay, I'll speak to you later. Bye. So yeah, I've just done my second visit. It was a quick one. I was just literally dropping off the medication and I just said hi to the patient. So now I'm gonna head back to the office and yeah, do my plenty paperwork. All right, see you later. Bye. So when I saw this shop, I slowed down and I was looking to see if they had this wardrobe that I've been looking for, tiny wardrobe, but they didn't have it. So I carried on my journey to work. So yeah, I'm back in the office now. Oh, the lighting is a bit funny. Yeah, I'm back in the office now. I think those were my outside visits for the day. Just 2 today completed. Now I'm just gonna go and do paperwork, and as I said, I'm gonna be triaging, so I'll be on the desk later. I might speak to you about that. Parking situation is crazy. I've just blocked someone in as well, so they're gonna be looking for me sooner or later. And just in case you didn't read the caption or the title, so I work in a mental health access hub and home treatment team, but it used to be known as the crisis team. So it's the mental health crisis team, and usually it's adults that I work with, adults who are in mental health crisis, basically, or whom we're trying to prevent a mental health crisis for, in a nutshell. I've had to come out because of the person I was blocking. So I had to move my car. I'm well parked now, but most likely someone else will block me in. But this is the game. Yeah, it's lunchtime. I've got my goodies and my goodie bag. These biscuits will be for later when I'm triaging anyway. I had some leftover curry. So I just brought it with some rice. I know it doesn't look good, but it tastes yummy. It tastes really good. So it's just some chicken, some carrots, and some peppers, just with some boiled rice. So that's my lunch. Báwo. Oh, I'm in a meeting. I'm busy. No, okay. Ṣé àwọn pípín yẹn ti wá pè padà? Kí ló ń ṣe wọ́n tó ń ṣe békebèke? For one, mo ti sọ fún wọn kó máa pè mí lọ́jọ́ Monday. Wọ́n tún pè lọ́jọ́ Monday again. So generally during my lunch break, I tend to check in with my husband because my lunch is not fixed. It gets given to me or allocated to me usually on the day. So, and I just check with him if he can have his lunch at that time because his own job is more flexible. And we basically just gossip, just talk about how our day is going, just checking in on each other. And we just gist. So that's basically what we do. So earlier I spoke to you about triaging. So now I'm on the triage desk, and what we usually do on the triage desk is, as a clinician, a qualified person, we take any urgent calls coming in or all the referrals that are urgent that are already there, and we try to speak to the patient, and based on the conversation with the patient, we make a clinical decision about what the patient might need. So sometimes we have to move very fast, we have to act very fast, we have to maybe call emergency services, and sometimes we step down the referral if we feel that it's not as serious as how it was presented. So basically this is the tough part of the job because you can't really see the patient. And just to give you an example, I've had patients who said before that they were just by the bridge and wanting to jump off. So you can imagine how stressful these bits can be, and you just have to drink and make yourself loads of drinks and get through the day. And also you have to check with your colleagues and just check some of the decisions that you're making because sometimes it can be really difficult. So we're coming towards the end of the day now. So happy. Well, the time is 7:59 p.m. We should finish. You need me to help you with anything? You can see that my legs here are so quick. This was after 8 p.m. Handover done because you have to hand over to the night staff. It is a 24/7 service. So now it's like I can't wait to get into my car and just get home. Right. I think it's about 8:10 now. I've just finished. Whew. And I'm just gonna drive home to see my beloved husband and my children. It's been a long day. Thanks for staying with me.